When you get to a certain scale, it's not just about the size, it's also about the tools and the resources that are available that influence the way people make choices. My name is Todd Gentzel. I've spent about 20 years in healthcare. Most recently, I spent a little over 3 years at Texas Health Resources in Dallas-Fort Worth. If you take a look at Texas Health as a whole, certainly within Texas, it would be considered one of the largest. Every large health system that's got the number of assets that Texas Health has runs into some really important issues around utilization. The number of opportunities for choice are expanding, and when that happens, the ability to actually find a way to educate the consumer quickly and get them into the right kinds of solutions early, it's good for them and it's good for health systems. It's not uncommon at all for primary care physicians to be misutilized. It's not uncommon for specialists to be used by patients like their primary care physicians. Those all have real downstream consequences, both for the system and for the patient. What we started talking through was like, how do we actually think deeply about consumer choice, that end-to-end consumer journey? And these folks at DexCare, they're doing some really interesting things. We began to realize that this was a unique solution. Without DexCare, you're in an environment where you're running searches and you're basically trying to cobble together these very complex systems. You're shutting down alternatives, you're lengthening time to access, you're creating the conditions for people to move on and go somewhere else. DexCare, it's a self-scheduling tool that allows you to fully leverage and appropriately leverage your assets. At the heart of it, DexCare solves the most basic issue for health systems. It's really a very clever way of providing consumers the ability to look at and evaluate their care choices and put a lot of this back into the hands of consumers. There's really nothing out there that compares favorably to DexCare. Giving people real immediate access, I think it's the ballgame.